Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice Private Physicians Medical Associates, PPMA, with your hosts, Registered Dietitians and Nutritionists, Papanos and Romana Brennan.
Hello, everyone, and welcome to the Nourish MD's podcast. I'm one of your hosts, Lauren, and I'm joined by your other host, Romana, today. And we are going to be doing an introduction to our nutrition department at Private MDs at PPMA. We're going to be walking you through really what services we provide and really explaining to you the goal of why we have preventative nutrition services, and then also doing an introduction so that you can learn a little bit more about myself and also Romana. So we're really excited to kick things off with the podcast and to provide you a little bit of an overview of an area that we're so passionate about. So just to kind of kick things off and really introduce today's subject, I wanted to first and foremost start off by just talking a little bit about what is the difference between a registered dietitian and a nutritionist. So Romana and I both are registered dietitians and we're our nutritionists. So we essentially can do both. And the difference between a registered dietitian and a nutritionist is actually pretty substantial. A lot of times the names are used interchangeably, but in order to be a registered dietitian, there are specific requirements that you have to go through, both from an educational and didactic standpoint, as well as a internship or fellowship standpoint. So I have my bachelor's in nutrition. Romana's is in biology, I believe, right, Romana?
Yes.
Yeah, biology. And then we both have our master's degrees as well in nutrition with a little bit of different emphasis within the nutrition piece. And then once we got done with those specific requirements and we took enough of the sciences that were required in order for us to be able to apply for our dietetic internship, we then completed a 10-month dietetic internship. And that's where you rotate through different settings, both in like acute care in the hospital setting, outpatient care. I did a functional medicine one, as well as some sports rotations. And they really just vary based off of your specific department that you're under. And then once you've accomplished enough hours and you've accomplished the competencies that are required of you, then that's when you can sit to take your registered dietitian exam. And that's a board certified exam that then you receive your credential if you pass. And then you're able to practice as a licensed registered dietitian and work in various different settings in healthcare. So registered dietitians are the only nutrition professional that is able to practice what's called medical nutrition therapy and to be able to diagnose nutrition-related problems, which means that we can work with you if you have a diagnosed medical condition such as diabetes or renal disease and provide nutrition and supplementation recommendations that are specific to treat your condition. And we also can order and analyze lab testing and integrate that into your treatment plan. And then we can also make sure that you have the support as you are working with your physician and working alongside of your care team. Whereas with a nutritionist, it really doesn't mean anything. And it's not a term that's actually regulated. And so anyone can actually call themselves nutritionists, whether they have a ton of education or no education, anyone is able to. And so really a nutritionist is probably just someone who has interest in nutrition, maybe has some certifications. There's so many programs online where someone can, just complete a couple month-long certification and that's in nutrition and then become a nutritionist. And it's not something that's actually regulated in terms of the curriculum that they're learning. And they also aren't learning the background of science that we had to, such as things like biochemistry and biology and chemistry and organic chemistry and such, that are really important to being able to understand how the human body works and the safest practices to implement for nutrition. So I think it's really important because those two names are used very interchangeably. And Romana and I are both proud to be registered dietitian nutritionists so that we can really support you in whatever health goals and health conditions that you might be experiencing so that we can really help you heal with food as medicine. And so a little bit about PPMA nutrition. PPMA's had a nutrition department for a very long time because it's something that the doctors are very passionate about. And if you listen to our last episode, you learned a little bit more about how the doctors see nutrition fitting into their treatment approach. And our services that nutrition has provided have really expanded over the years. I've been with PPMA for going on 4 years now. Romana has been with PPMA for almost a year now. And when we first started, we were just doing individual nutrition consultations, nutrition appointments. And that was just a one-on-one appointment between patient and the registered dietitian. And we've expanded that slowly over the years to now include monthly group sessions. And those are something that we've been providing for, I think, about 2 years now. And they're on various different specific topics related to nutrition. And they're in a group setting that we do virtually through Zoom. We also have PPMA Pharmacy, which is our monthly recipe subscription service that are recipes that are especially curated by myself and approved by our doctors. And it's something that you can sign up for so that you can receive done for you meal plans for what you should or can eat for you and your family for the week, which is really awesome. And then we also have expanded from just offering supplements in person through our orthomolecular company that we highly recommend, to now offering a lot more companies and a lot more ability to have different items at your disposal through our online vitamin dispensary, which is called FullScript. And anyone can sign up for a FullScript account that's a patient of PPMA. However, if you want individualized vitamin recommendations, then that's where we recommend scheduling a one-on-one nutrition appointment so that you can receive customized vitamin recommendations from us. So those are just a little bit of an overview. And now we've got the podcast, which is just kind of an extension of everything that we do at PPMA, both nutrition as well as in the medical side of things with the doctors. And we're really excited to be able to just really empower and educate you more. And just to kind of give you a little bit more overview too of what we really do with the doctors. When it comes to our nutrition appointments, we have full access to your medical record. And so sometimes we'll connect with the doctor prior to see why they recommended you to visit nutrition. If it maybe wasn't a referral and you self-referred, you set up the appointment, then we'll definitely review your chart and understand a little bit more about your health history, go through all of your lab test results from the last couple of years so that we can understand what your health status has looked like, review any previous notes from any of your physicians or specialists that you've seen over the last couple of years. And from that, we'll really be able to gather a little bit more information about your specific health needs. And then during our appointment, we will ask you questions and provide personalized recommendations of what we recommend for food, as well as what we recommend for supplementation, and sometimes even lifestyle things like exercise, movement, stress management. They may accomplish that, complement what we recommend from a nutrition or diet perspective. And we try to be as integrative and holistic as possible with this, and understanding that the body is all interconnected, and that, if you've come in looking for support for your blood sugar, that we're also going to ask questions about stress management and exercise and other things like maybe your gut health and such, because those are going to play into what your blood sugar regulation looks like and how you're going to be most successful with improving your diabetes or your blood sugar management. And then we are, very adept in lab analysis. And so if there are any recommendations that we have for testing labs, then that's something we'll work with your physician on to make sure that they have the test results that they need to provide the medical recommendations, and that we have the testing information that we need to really personalize your nutrition and supplement recommendations. So hopefully that's a good overview of everything that we provide in the PPMA nutrition department. And I know Romana wants to talk a little bit about what that looks like in terms of how we integrate nutrition into the care process with a patient.
Yeah. So Lauren, I think you provided just a fantastic overview of what that time together looks like, whether that's in a group session, which occur monthly, or in our nutrition consultations and follow-ups, which are our one-on-one appointments. So as you had mentioned, so we have patients who their doctor may have reviewed their labs, but they recognize the importance of nutrition when it comes to altering lab values and promoting general wellness, or maybe it's related to your specific condition. So we often get our referrals from Dr. Weiss, Dr. Van Meter, Dr. Davis, And so we have patients come to us that way, as well as individuals who maybe have been wanting to visit with a dietitian for a long time, or who have particular questions that we're very lucky to have doctors who really understand the importance of integrating nutrition into patient care in order to continue to promote that preventative, proactive environment that PPMA really values, I would say. And so it's great to have doctors who are able to defer to us, since we have that experience working with individuals, talking them through their nutrition needs, and really connecting the dots between your lab values, your lifestyle factors that may be contributing to some of the conditions that you're experiencing. So regardless of if someone is a self-referral or if they're a referral from a doctor, as you had mentioned, we have access to all of your medical records, which provides us with such a better view, as opposed to, maybe there was something that we might think is related to where your health is now that was from a couple of years ago that you may have forgotten to mention. So it's helpful for us to have that holistic view. Of course, there are bits and pieces that we really do gather from the patient, but it's helpful to get that full health history and to get an idea of maybe what were some supplements that you were taking a few years ago, and how did we see your lab values alter and change in the past compared to where you are now. So I would say lab analysis plays a really big role in the work that we do with our nutrition consultations. And again, the doctors have their recommendations, we have ours, and together, I believe personally that just creates such a synergistic combination and ability to care for our patients in that way. So supplementation, some people love it, other people want to have more of a food-based focus, and Lauren and I really value both of those approaches and talk through both of those perspectives with patients often. And I think it's really important, whether, like you had mentioned, Lauren, whether you're dealing with diabetes, how can you and I build up the framework and really address all of the factors that might be going into that, whether that is talking through meal balance and what your plate looks like. Maybe it's just the timing of your meals, and we just need to make a few tweaks and then repeat your labs and see how that's affecting your blood glucose levels. Maybe one of the nice things that our doctors discussed in the last episode is our home care monitoring, and we can set you up with a glucose monitor and make some dietary changes and walk you through that kind of self-experimentation of trying to figure out what works best for you in terms of what foods your body is responding to well, and maybe some other things that might be sending you on a blood sugar roller coaster that we can make alterations. And maybe supplementation isn't involved at all, but there's a lot that we can do in terms of lifestyle factors and nutrition factors that we tweak. And it's really valuable for us as dietitians to be able to impart our scientific knowledge and make it accessible to people, to make it digestible. No pun intended. Actually, yes, pun intended. But I think that's one of the things for me, just kind of transitioning into why I do the work that I do. And then Lauren, will go to you, why you do the work that you do. But just being able to impact people on the day-to-day things that we know that there's a gap between what our doctors tell us in our appointments and making those things everyday practices, everyday habits. And I think as dietitians, we are really well placed in that middle ground and really being able to impart that knowledge and help discern how individuals can take health recommendations and really make it work for them. So in terms of how we integrate nutrition into the care process with the patients, as Lauren had mentioned, heavy emphasis on lab analysis and kind of communicating what those things might mean and the implications in terms of our health and our nutrition, our group sessions, again, imparting that knowledge in a group setting, in a webinar type style, our pharmacy program with our recipes, making sure that patients are equipped, that they feel empowered to cook meals that they know have already been vetted by their personal doctors, which is really unique and not something that is widely available. And then, of course, our full script program, having those practitioner grade supplements, those higher quality supplements that we know are approved by your care team and recommended by your care team with dosages that are specific to you. So all of our programs really do come together and weave nicely into how we can provide that nutrition foundation for preventative health, for proactive care for our participants, ultimately just giving them the time and attention that they need and deserve.
Enjoy high-quality supplements shipped right to your door with full script through Private Physicians Medical Associates, PPMA. Reap the health benefits of pharmaceutical-grade vitamins while saving 5% on all orders. Set up your free PPMA account today. Visit privatemds.com.
With that, Lauren, I know I had mentioned briefly my kind of why behind it, but I would love to know kind of your journey of becoming a dietitian and your why, some of the things that you love about being a dietitian at PPMA.
Yeah, I mean, I have been obsessed with science for as long as I can remember. Since I was 7 years old, I actually wanted to be an astronaut when I was a little girl, but I've always just really fallen in love with science, excelled at it, and really just been fascinated by the human body. And growing up as a young girl, my mom was always had an organic garden, was always growing her own produce, and she's not a dietitian or anything, but just always was very focused on just teaching us little nuggets about homeopathic type remedies, right? And so I just always thought that was really cool, and I really fell in love with food as medicine at a really young age. Some people, they say that they're a foodie and that's why they got into it. I've never really been a foodie. I've always just loved like the science of food and herbs and how those can impact our health, and found that fascinating. And so that was one piece of it. I also am really fascinated by the human experience and by hearing people's stories. And it's something that brings me a lot of joy, is being able to connect with other people, being able to help them. I kind of consider myself to be more of an empath. And so I just feel like, understanding someone's experience, learning from other people, it truly is one of my favorite things. And it's one of my favorite things about seeing PPMA patients is that I have learned so much from the patients at PPMA that, have lived life for many years prior to myself and have taught me things that they've learned along the way, and just have so much perspective on life. And that is really fascinating to me, and is something that brings me a lot of joy. And, I love being able to help people heal with food. I really just think that's the coolest thing in the world, that the substance that we need to survive every day can be the, quickest form of poison, or the, quickest form of healing. Right. And so I just really think that having the power to impact the way that we feel and function through something as simple as what we put into our body is so important.
I love that. I think that's so important. What do you feel like the biggest takeaway is for you personally? Something that you've learned over your past 4 years at PPMA?
I think that it's just knowing that everyone's way and their route of getting to the end goal is different. And when I first started out my career, I think that I was so passionate. I still am. I'm so passionate about nutrition and all of the factors that go into what we do every day. And I didn't really think that there's many different ways that someone can accomplish that end result. I just always thought it's the way that you understand. And I think that really being able to connect with people and, learn from patients that are different ages, that have different lifestyles, that have different setups. I mean, there are no two people in this world that are the same. Like, every patient is so different. And that's one of the cool things about our job, is that we're not just here to provide you recommendations. We're here to really understand and learn your story, and then figure out how we can really personalize those recommendations to work for best for you, so that you can be successful in making those changes changes. And so even yesterday, I had a patient where I was talking with him and he said, I know this is not what you like, you want me to do, Lauren, but this is what works for me. And I said, you know what? I actually don't, I disagree with that. I don't necessarily believe that that's not what I recommend. Of course, it's not what I would, initially say is probably the best route to be able to get there, but you have a completely different lifestyle than I do or than other patient. And my job is just to understand what's going to work best for you and what's going to be most successful. So I think that really just being able to personalize and modify the treatment plan or the recommendations based off of each individual patient's case is so critical.
I 100% agree. And I think the second we forget that how important that is the second that we're reminded just how different everyone is and how unique of an approach we need to have with everybody. And like you said, no two individuals are the same. No two individuals are going to learn in the same way or receive a message in the same way. And I think it situates us in a really cool spot to be able to take the time to learn and understand these patients on an individual basis in order to help care for them in the best way possible that they can receive that care. So that's definitely one thing that I appreciate about PPMA and just the concierge medicine model is being able to take that time. We're not being rushed with our patients. We can take the time to understand them, to hear them out, to listen to their concerns, to listen to their goals and what they would like to get out of our nutrition sessions, because, we can have our goal for these patients, but it's their life, it's their health. And I think being able to take the time to listen and understand people on an individual basis is really important and something that makes PPMA unique. So I completely agree with you saying that, Lauren.
Amazing. And Romana, maybe you could just tell us a little bit more about just your kind of background or like your why in becoming a dietitian.
Yeah. So as you had mentioned, I did not study nutrition in my undergraduate schooling, but I studied biology. I wanted to be my line in high school, way back when, I wanted to be an orthopedic surgeon in the military. That was I thought that was what I was going to do. And I don't know why I clung so tightly to that. But, as college went on and I kind of broke down that dream of mine, I think I realized it wasn't my dream. And I realized that while orthopedic surgery is wonderful, I really wanted to maintain connected to people. And I had to kind of come to terms with, okay, I love health. I love being able to talk to people about health, but what am I actually passionate about? People, food, culture, how all of these things intersect and come together to create a unique food environment and a unique perspective of how someone views their food and kind of approaches nutrition. And that I didn't even know what a dietitian was until long after high school and learning about medical school and PAs and all of this. So I think once I realized that was a potential career, it felt so much more aligned with my personal values and how I wanted to show up in a career to serve people. So my why behind being a dietitian is just being able to kind of what we've discussed already, meeting people where they're at and learning their stories and being able to break down nutrition information, health information, and really help bring that to the everyday lives of people and helping walk them through their own health journey, because we can only encourage and give messages and try to support someone. It's like they're the captain of their own ship. And I think being able to partner alongside individuals is really powerful, as opposed to them looking to you to fix maybe their problems or issues. But for me as a practitioner, it's really empowering to give people the tools so that I can support them, but ultimately it's them doing the work themselves. So I think that's probably one of my biggest takeaways, is just how do we meet people and be the best support system for them to empower them in their own health journey.
Awesome. Well, thank you everyone for tuning in to today's episode. It's so great to be able to share with you something that we are so passionate about. And if you are interested in learning more about any of the nutrition services that we provide at PPMA, you can head on over to our website at privatemds.com, where you can find a little bit more information about all of the things that we mentioned today. And if you want to set up a time for a one-on-one nutrition appointment with Romana, you can do so by giving the office a call, and they'll find a time that works best for you. And we'll be back in 2 weeks with another episode. We are so excited to continue on these next couple of months and hopefully many years to come with the Nourish MD's podcast. And we'll talk to you soon.
See you next time, everyone.
Thank you for joining us for today's episode of Nourish MD, Dr. Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.